All right, in this explainer, we are breaking down the evidence-based dietary strategies for managing high lipids. We're going to frame this specifically for clinical practice, giving you the tools to prescribe diet as a really powerful first-line therapy. This number right here, this is why we're talking about this. 29%. You can potentially lower a patient's LDL cholesterol by that much with diet alone. Now, this is especially true in patients who have a pretty poor baseline diet, but still, that's a seriously potent tool to have in our clinical arsenal. But, with all the options out there, from big, comprehensive diets like Mediterranean to just adding specific foods or even supplements, where do you even start? It can feel overwhelming. So to make sense of it all, we're going to structure this whole thing using a clinical pyramid approach. So here's our roadmap. We'll start at the bottom with those big foundational diets. Then we'll move up to the middle for some really practical food swaps. After that, we'll hit the peak and talk about supplements. And finally, we'll tie it all together with a counseling framework you can literally use tomorrow. Okay, first up, the base of our pyramid, foundational diets. Think of these as the big picture interventions. These are going to be your most impactful first-line recommendations for patients who are actually motivated and ready to make some broad changes. I find this chart incredibly useful. It's such a high-yield comparison of how these different diets hit different parts of the lipid panel. So for example, if you've got a patient with isolated high triglycerides, a low-carb approach might be a great starting point. But for just straight-up LDL reduction, DASH or a vegetarian diet are really strong contenders. See, this is what we mean by personalizing the prescription. And here's a rule that is absolutely universal. It applies across the board, no matter what diet we're talking about. The one thing every single patient needs to avoid is industrial trans fats. You find them in a lot of commercially prepared and fried foods, and they are just bad news for the entire lipid profile. They tank your good HDL and raise everything else. It's a non-negotiable. Okay, so what about our patients who just aren't ready for a complete dietary overhaul? I mean, let's be realistic, that's a lot of them. Well, that brings us to the middle of the pyramid. This section is all about targeted, high-impact food swaps and additions that are practical and can still make a huge difference. A super simple but really effective swap is protein. Just counseling a patient to replace red meat with leaner options like chicken or fish is a fantastic start. And if they're open to it, substituting animal-based foods with plant-based proteins like tofu or edamame is even better. They're low in saturated fat and can have a real, measurable impact on their numbers. And here's another easy one. You can counsel patients to swap out refined grains like white bread for high-fiber whole grains. That right there is a great way to boost their soluble fiber. Another simple one? Using nut butters instead of dairy butter. It's a small change that really improves the fatty acid profile of their diet. Now, we just mentioned soluble fiber, and I want to pause on this for a second because it is such a key player. This stuff, found in things like oats, beans, and psyllium, is incredibly effective. In fact, get this. For every single gram a patient adds to their daily diet, you can expect their LDL cholesterol to drop by an average of 2.2 milligrams per deciliter. That adds up fast. And to put that in a clinical perspective that we can all appreciate, check this out. One study took patients on 10 milligrams of simvastatin and found that adding 15 grams of psyllium every day had an LDL-lowering effect that was equivalent to doubling their statin dose to 20 milligrams. That is a powerful synergistic effect we can get just from fiber. Okay, so beyond fiber, what other targeted tools do we have? Well, counseling patients to add a daily handful of nuts like walnuts or almonds is a great one, or telling them to use plant sterol-enriched spreads. Plant sterols are actually fascinating. They can drop LDL by 10 to 14% just by blocking cholesterol absorption in the gut. And now we've reached the peak of our pyramid, supplements. It is absolutely crucial to frame these correctly with patients. They are adjunctive therapies. They are a complement to diet and lifestyle changes, not a replacement for them. So what actually has some evidence behind it? Well, omega-3s are fantastic for high triglycerides. Berberine and certain probiotic strains are also showing promise in meta-analyses. And then you've got red yeast rice. It's definitely effective, but man, we really need to take a closer look at this one. And this quote from the source material just hits the nail on the head. Look, red yeast rice works because it naturally contains statin-like compounds. But the problem is, these supplements are not standardized. The amount of the active ingredient can be all over the place, and worse, some products have even been found to contain a kidney-toxic contaminant. This is exactly why a prescription statin is just a much, much safer and more reliable choice. You know, this slide is just as important as the last one. This is your do not recommend list. Patients are going to ask you about these all the time. Popular supplements like garlic, coconut oil, resveratrol, they just don't have the high-quality evidence to back them up for lipid management. And some, like those concentrated green tea supplements, even carry serious safety concerns, like liver toxicity. Okay, we've covered the pyramid from the bottom to the top. So now let's pull all this information together into a practical framework that you can take with you and use in the clinic. But before we dive into the steps, this is probably the single most important principle. Personalization is everything. There is no one-size-fits-all diet. You have to consider the patient's specific lipid profile, their other health conditions, and, just as importantly, their personal and cultural food preferences before you recommend anything. So here it is, your actionable 4-step blueprint. It's super simple. Step 1, assess the whole patient, labs, comorbidities, what they like to eat. Step 2, if they're up for it, recommend a broad dietary pattern like Mediterranean or DASH. Step 3, if that feels like too much for them, suggest those specific high-impact food swaps we talked about. And finally, step 4, discuss the very limited complementary role of supplements, always emphasizing evidence and safety first. And really, this whole framework is designed to empower you to answer that exact question for each unique patient that walks through your door. It allows you to tailor a powerful, evidence-based prescription that goes way beyond just writing for a medication. Thanks so much for joining this explainer.